Welcome to Straight Talk about Health and Wellness. My name is Mary Henderson and I am your host. Today we are having a wonderful show. Of course, I always say that, but face it, we do. All right. We have real conversations with real stories. I mean, real stories. Today, our topic will be health, health prevention. All right. I had a hard time getting that out, but although I had my mushroom coffee, but we're gonna take it slow today, all right? I'm suggesting you get a pencil and a pad out because you will need to take notes. This will be some very valuable information that you should always remember to share with your family, your neighbors, and don't forget it for yourself because this show we aim to give you information so you can be your best you. I like that, your best you. But today, all right, I have two special guests. I am so privileged. I am so blessed. I have Almeda Jones. Actually, she's my co-host. You guys always saw me all the time, but today I have a co-host. So don't let me forget. So I won't talk too much. I have a co-host today. Amita Jones. All right, she is a grad student from the University of Washington, Seattle. So she's all the way from Washington, Seattle. All right, and she is pursuing her master's degree in social work. Boy, a social worker takes a special person to be a social worker. I was a foster parent for like 15, 16 years, and I had many social workers in and out my house. And the things they deal with, it takes a special person and a patient person. So kudos to you for entering a master's program in social work. All right. And also, yay, I told you this was a good show. We have Adrienne Tillman. All right. She is a registered nurse. Her background is community health. Yay, yay, Mary. Look what I have today. All right. Amida, I'd like for you to tell the audience a little bit about you.
Okay, my name is Almeda Jones, and I go by Allie. I am getting my master's at UW Seattle. I'm originally from Chicago. I have 3 dogs, and I'm really passionate about healthcare disparities and equity, medical racism and medical bias, and helping us advocate for ourselves when we go to the doctor.
Fantastic. And we need that. We need that. Well, thank you. Thank you for the opportunity. All right. Then we have Miss Adrienne Tillman, registered nurse. Tell us a little bit about you.
Okay, so my name is Adrienne Tillman, and I'm originally from Kansas City, Missouri. I'm from the Show Me State. And I have 2 kids, two adult kids, and one granddaughter. And I am an RN. I've been an RN for 30 plus years, and I have enjoyed nursing, and I enjoyed the different aspects of nursing. So my background has mainly been med surge in the hospital, but lately in my latter years, I, I am trying out community nursing and public health.
Nice.
And so I like what Ali just said when she introduced herself, that I'm definitely interested in preventing health disparities and things and that whole situation. So I'm glad to be able to talk to you with you today.
Fantastic. Oh my goodness. I'm around all this education and this knowledge and this wisdom. I don't know how to act. My goodness. This is fantastic. Our topic today is health prevention. All right. So I'm going to ask you, Adrian, registered
Mhm.
nurse, what is the meaning of health prevention?
And to me, the definition of health prevention is really about taking steps to take control of your health and make positive changes to stay healthy, because this world is, as we're being exposed to a lot of different chemicals and different things, some in the foods we eat, and just there's just actions that we can take to help ourselves be healthier. And so that health promotion, prevention, It's really about taking care of yourself and doing what we and you can do to stay healthy and on the healthier.
Fantastic. And that's an ongoing thing if you want to stay healthy.
Mm-hmm.
How is it different from treating illness?
And then so then health, if we're doing and taking steps what we can do to stay healthy, get our wellness checks done, then we can, it can avoid being ill or even getting on that spectrum of illness and having to be hospitalized and those kind of things. So we want to do what we can do, our annual health checks, our immunizations, checking our blood pressure, exercising, eating right, all those things are just an easy step to do to prevent us from getting ill or sick and being hospitalized.
I hear you say prevention. All right, that's what I hear. I hear you say prevention, your blood pressure, your screenings, and things like that. And us as humans, we would like to be healthy.
Mm-hmm.
It's healthy for yourself, healthy for your family, healthy for your neighbor, healthy for your dog.
Yes.
The next question I want to ask: why is it so overlooked?
Well, there's different reasons, and Ali might want to add to that too with the disparities. But a lot of times, people they put others ahead of themselves. Mainly, parents will put them, everyone else, their kids, every grandparents, whoever, in front of themselves, and then they
Mhm.
kind of let themselves go. And then it could be cost. It could be they feel like they don't have the insurance, or they may not have insurance, or they may not take the time, realizing that it's important to take that time now versus later. And then there are some disparities that can interfere with that. So I wonder if does Ali, do you have anything to add with that?
I agree with you. I think parents and people put themselves, like they put others above them. And then I think cost, because we pay for healthcare here in
Mm-hmm.
America. So I think that plays a big part of it. Even if you have insurance, if you have like a deductible or a copay,
Mm-hmm.
depending on what you have, you might not follow through with, let's say, a referral. Like if you have a referral for physical therapy, but if you have like a copay or a deductible, then you have to come out of your pocket maybe like 200 before you can even do that. And the price of living has gone way up, so the dollar doesn't have the buying power that it used to. So I think people put off like preventative, like screenings or preventative health care, just because probably I think price is a big part of it right now. And I also think like work schedules are really burdensome for a lot of people too. Just like
Mm-hmm.
living has just become more difficult. So I think it's I think it's just one of the reasons, a bunch of the reasons why putting off like preventative measure health screenings until a crisis occurs and you have to address it, and then you might end up in like the emergency room or urgent care. So, yeah, I think our society and our system is not helping people take care of themselves. So, I would just remind people, just like be kind to yourself, because you're not doing this to yourself alone. Like our country is not helping you be better, also.
And I do agree because healthcare has went up, even with the Medicare. All right, to
Mm-hmm.
get an extra insurance, you pay that extra dollar with that.
Mm-hmm. Mm-hmm.
So Allie, I'm gonna let you answer the next ask the next question.
Yeah. So, what are the top three preventative practices that everyone should practice?
I would say definitely diet, exercise, and just getting your advocacy with your advocating for yourself also. But definitely diet, watching the foods we're eating, cut down on the sugars, the fats, and try to eat more plant based vegetables. That seems to be where it's going right now. Is the plant based, and even I heard an oncologist speak recently as he's retiring. He said, this really is easy. All you have to do is eat better, healthier. If you can prevent cancer, just eat better.
That's so
So
easy to say.
I know it is. Because
Oh,
the
that's so
commercials
easy to
don't
say.
make it easier. You see all these, oh, Burger King's got this extra burger fat bacon on it, and all these
Mhm.
everywhere you go, you look at the commercials and they look so delicious. And don't go to an ice cream place because then they
Oh my goodness.
but it's okay to treat yourself every once in a while, but just moderation.
Sometimes.
Moderation is what it's got to be. Moderation. And
Oh, that's
so,
a big M word.
yes. And then also cutting down on portion control on your plate, eating more frequently. Exercise is definitely it, because the same oncologist I'm talking about,
Mhm.
they're finding in their studies that exercise can cut down the risk for cancer. And so he said, it's folks, we can do this. Just even walking. He said, walk 30 minutes a day. How hard is that? You know, or if you want to get a gym membership, you can, but you don't have to. But just even 30 minutes a day, either 3 to 5 times a week would be
Mhm.
sufficient. So those are my main three.
Yeah, I do agree. I have a water aerobics instructor, and he tells us move, just move. You live to be 100. That's what he said.
Yes, yes. And speaking of that, they're doing more studies too on the blue zones. I
Uh
don't know
huh.
if you all have heard about the blue zones. Is the blue zones is like six places in the whole world where people live to be 100, and they're doing a study to see what is it that helps them live so long. And one of the things is eating less meat and a lot of plant-based vegetables and things, and exercise. Those are the main things that's keeping them alive, and getting fresh air, going outside
Hmm.
and walking or jogging or biking. Those kind of things are really helping. So yeah, the blue zones make a difference in how, I mean, the exercise and all makes a big
Hmm.
difference in how long you live. And the saying is really true. Just keep moving, whatever you do. You can exercise sitting down. They got those foot um, like a bike that simulates a bike.
Hmm.
You can sit down and
I've
exercise.
seen that.
You can move your arms. It's so many different things you can do. So it's like there's no excuse why we can't at least exercise or move 30 minutes a day.
There's no excuse. No excuse. I even have one of those plates, the vibrator plates.
Uh-huh.
Yeah, and I just shake up and down. I shake up and down one of those things. I don't know what it's doing, but anyway, you're
Mm-hmm.
doing something.
Yeah. Yes. That's the key, doing something.
You're doing something.
Yeah.
All right, Allie. Okay, you want to
So
answer
for the
that
next
question?
question, how does early detection through screening help save lives?
Oh, and that's a whole topic. It could be a whole topic itself. And I am also functioning as a breast health navigator right now in my current nursing position. And so I really believe in mammogram screenings, getting them once a year. That really can save lives, because the early detection really is the key. And so the breast mammograms once a year, the early detection is that if you find it early enough, you can treat it simply. May not need its extensive surgery or radiation and all. The earlier the better, because then it cuts down on the treatment plan and you can live longer. You can get it eradicated before it becomes all blown up, stage 4 cancer that they can't do anything for. And that's the same with for the women would be the mammogram screenings, the pap smears annually till you get to be a certain age. And then for the men it would be the prostate screening, and then colon screenings for the both men and women. Those are both very important, because colon cancer is happening in a lot of younger adults now. And you think of the actor that died of colon cancer, and he was in his, I thought he was in his 40s or 50s,
It
so it
was
wasn't
Black
quite.
Panther, I think. Yeah.
Yeah,
Mm-hmm.
yeah, and that
Chadwick
was like,
Boseman.
yes, he should not have died at that young age of colon cancer. And
Okay.
so if colon cancer is picked up, any cancer really is picked up early enough and detected, it can be treated simply and eradicated. Therefore, you can live longer. So that's the main thing. You can live longer with the screening. Things can be picked up quicker and treated, and you can go on and live your life.
Sometimes I think we don't get that type of message though for screening.
Hmm. Yeah.
because things you want to catch early.
Yes. And we think we can put it off. Oh, I'm too young for that. I'll deal with that later. But the thing is, another example is one of my friends, she knows of a lady who just died recently in her 40s of breast
Oh,
cancer, from
oh,
breast cancer. And
oh.
this and her reasoning was she studied, went to college, became a lawyer,
Mm-hmm.
and so she was so busy in her career and pursuing
Mm-hmm.
her career that she
Mm-hmm.
didn't take the time to go get her screenings when she felt the lump. And then
Oh.
she didn't have any treatment until it was too late. And by that time, she had several tumors and other complications, which could have been eradicated if she had just gone in earlier and gotten it treated. But instead, she ended up complications, ICU, and passed away before she was even 50 years old. So that's why we said the early screenings. And people do kind of put it off and think, oh, my career is going on, or, wait till the kids get a little older, or
Mm-hmm.
how am I going to fit this in when I got to get the kids to school and, do this and this and that. But you have to prioritize yourself. And it's part of self care.
Mm-hmm.
If we're taking
True.
care of ourselves, we're going to get those screenings done.
True. True. How can community education help with this?
Oh, and I think that can make a big difference because people can realize the importance of it. They can say, oh, okay, I do need to, this is why I need to go get my mammograms. This is why I need to get the colon screenings done, and why I need to avoid this kind of food or the fatty foods or the greasy foods or and exercise. They understand if they are educated adequately, then they will understand the moves and things they need, actions they need to take to
Mm-hmm.
to do the preventative thing and live longer. Live longer.
Yeah, that's true. We all want to live until we're 100.
Yeah.
As my instructor said, just move.
Yeah.
Just move. Okay. All right. Allie, I'm going to have you ask the next question.
Yeah, you might have already answered this, but in what ways can diet and nutrition act as preventative medicine?
Yeah, and that's just reiterating the importance of watching what you eat and the portion control and nutrition. Like we said, is really the vegetables have lots of fruits and fruit. I mean, the vegetables have lots of antioxidants, and some of the fruits do too. So the antioxidants is in your body what helps. It helps fight the cancer cells and all, and prevent them from forming. So that's why diet and nutrition are very important.
Thanks. And in what role does mental health play in overall preventative care?
And mental health also is important because it's sometimes how you look at things, also how your what your previous experience was growing up. You may say, "Oh, this was I saw such and such die of cancer, and I don't want that happening to me. So I'm going to do what I need to do to prevent that from happening." And then mental health is another subject too because that's so important for us to have good mental health, do what we need to do, self care, take time out for yourself, go get a massage or walk. Even just getting fresh air every day is going to help your mental health. And then exercise just helps those endorphins, the chemicals in your brain move and help you feel better. Get the dopamine and all the things in the brain going. And then, you feel better and you got a better outlook on things. Does that help?
So you can think a little bit clearer.
Yes, and think more
Yeah.
clear also, and deal and cope with things better.
And then there's circulation.
Yes,
Yeah,
yes,
we
and the
exercise.
exercise gets the circulation to the
Mm-hmm.
brain,
Moving oxygen.
moving. Yes, all of that helps. Yep, you got to have the circulation going to your brain to help you think better and react better, and have a better perspective on things and remember things better.
Yeah, we can remember things better because we're getting oxygen to your brain by moving and
Hmm.
circulation. I try to do that every morning. I really
Yeah,
do.
it really is important. It's kind of like a cycle of or a chain reaction
Hmm.
that you're exercising. So it's getting circulation going in your body, then it's getting your brain, you're thinking, you're seeing, everything's starting to wake up and work better.
Okay, Allie, you want to ask number 10?
Yeah. How does physical activity contribute to long-term disease prevention?
And that's kind of like what we've been saying. The physical activity, it affects everything. It can affect your weight gain. Just it contributes to your body, your intestinal working good, so that you're getting rid of the poisons and toxins in your body, and yeah, you're just functioning. Your body is functioning better overall, and you're preventing stiffness and what are they called? Arthritis, all the different names, Mr. Arthur and Mr. whatever they call all the different
All
names.
those radishes, huh?
Yeah, although they keeps getting another name.
Isn't that something?
Yeah.
Yeah, they name all those arthritis, author and writers, and all those. I think it's just keeping us moving.
Yes.
No, you have mentioned plant based. But what is plant based? Can you
So
explain
just
what plant based diet is?
so I'm thinking more of the green things that come from the earth. Thinking of broccoli and things that you can
With cheese?
grow.
With cheese?
Did you say with cheese?
Uh-huh. With cheese and bacon? Are we talking about that?
No,
That
no,
broccoli?
we're not talking about that. We're talking about the things that are naturally green that come from that you grow, like the broccoli, the string beans, the kale, the
Mm-hmm.
lettuce, those kind of things. Asparagus. Those are all healthier things to eat, and there's so many healthy ways to cook them now. Oh, and we just had some zucchini. Zucchini was really good grilled.
Oh, zucchini. Oh, that's delicious.
Yes,
With lots
yeah.
of with lots of butter.
Not so much,
That's delicious.
but tastes really good grilled. So there's a lot of good recipes out there too for eating the green things healthier. So asparagus is really good too. That goes with a lot of good things, and that's healthy.
Yeah, asparagus is good. They are good. They're very good with a wrap with bacon. Have you had some of that? Have you had some?
She keeps wanting to put
Don't
that
eat
bacon in
that.
there.
Don't eat that. But some people, I have had some before, but it's been a long time.
Mm-hmm.
But we need to watch out. We've been definitely when we get a certain age, we do need to watch out blood pressure, diet, and things like
Yeah.
that because we're not as active when we get a certain age. We're not as active.
Yes.
We should be a little bit
Yes.
more. All right, Allie, you want to ask the question?
Yeah. So, are there specific preventative strategies for women, seniors, or children?
You mean as far as prevention?
Mm-hmm.
Yes, for women, like I said, the mentioned earlier, the mammogram checks and the pap smears are very important because then they can detect if there's uterine cancer or cervical cancer. And then for the seniors, it really is good for them to do the balance exercises, and because that would help them be stronger. And then big thing is fall prevention, so that they won't, as you get older, you can lose your balance a lot, and then a lot of people have injuries even in their home and
Mhm.
falls. And then so that way the if they are doing the balance, I saw a balance class, they even have balance classes, they have things at the Y, um,
Mhm.
that program, can't think the name of it is, anyway, they have programs at the Y just for seniors and just helping them keep moving, helping them keep limber.
Mhm.
Weights also are good because even the arm weights, that
Mhm.
helps with the bone density, because that's also another thing that happens a lot in the senior population is the bones can become a little bit more brittle and easier to break. So if you're
Mhm.
doing the weight training, but it'd be low weights, but just repetitive low weights can help seniors strengthen their bones, so they're not as likely to break them so easy. And then for children, mainly, definitely getting their immunizations yearly, annually before they go to school. And I know there a lot of people seem to they don't want to get their immunizations for one reason or another, and there maybe some concerns or allergies and things like that. But then there are certain ones like whooping cough and all we should not be dealing with now, and
Right.
even the measles. that is
Right.
pretty much eradicated. So a lot of these vaccines are definitely good. They've been studied and all, and we've had good results. We've kept disease down.
Hmm.
But now
I
that
agree.
people are not wanting their kids to have them, all these things are coming back. And it's like measles. What? That was
I know.
eradicated a
Hmm.
while back. So why are we even having this issue with measles outbreaks and everything? So definitely immunizations for kids. The other thing for kids would be safety training, like you know, poisons, and also swimming, making sure they know about, no, making sure they can learn to swim or float, because there's so many. We want to prevent drownings. We don't want to have kids drowning. So that's another safety precaution, which would be preventative. And then I found out that they even have a class for kids to take that should they fall in the water, they know what to do. So they
Oh,
take this
nice.
class. Yes, in
Nice.
fact, my granddaughter took this class where you don't even wear a swimsuit, you just wear your clothes. And so that way,
Mm,
if they fall in the water, they know
right.
how to, turn over and float themselves so they
Nice.
don't drown.
Nice. Nice.
Yeah.
Well, this has been a very informative show here. I mean, I know you will be back. I know Allie will be back. I know our audience wants you back.
I hope so.
So you will be back because we need to hear that over and over and over. And we have different audience with different levels. All right. So we need to get the word out. And I appreciate you two helping me to do this. Okay, for our community, for our nation, for
Yeah.
our world. All right.
Yeah.
So we only have a couple minutes left.
Okay.
All right. So I would like for you, Adrian, to give your last words to our audience.
Well, I would just say prevention, whatever you can do, prevention is so important. Advocating for yourself, talking to your doctor, taking someone with you when you go to the doctor, have your notes ready, questions ready, because they don't have much time. And so just doing what you can do to stay healthy, eating healthy, watching what you eat, getting some exercise, 30 minutes a day or at least 3 times a week. And yeah, just focusing on you and thinking about it as self-care. This is your time for self-care. Whatever you have
It's
to
your
do to
turn.
relax, it's all about you living longer, doing what you can do to live longer.
That's right. And I forgot to ask about stress. Stress.
Oh yes.
Oh my goodness, that would took the whole show.
Yeah.
Oh my goodness.
Definitely.
All right, everyone. Thanks for coming.
Be
All
stress
right.
free.
All right. Until next time. Allie, you have anything to say?
Yeah, so if you get off work, I would say before you get home, like if you have like a lot of responsibilities, just like park your car, walk 15 minutes from your car, and then 15 minutes back to your car. That's 30 minutes, and then drive home. And that way it gives you time to just like maybe like get out of your head. You can think for 30 minutes. You can listen to a podcast. You can listen to music. You don't have to listen to
Okay.
anything, just your feet hitting the pavement. But park your car, walk 15 minutes from your car, 15 minutes back to your car. That's 30 minutes, and then go home. So you take care of yourself before you enter your house.
Yeah.
Fantastic. I'm gonna try that.
Yes.
All
Yeah.
right, I'm gonna sign off, everyone. So I'm gonna leave you be safe, be happy, and be blessed. Until next time, this is Mary Henderson from Straight Talk About Health and Wellness.
All right. Bye bye. Be healthy.